Choosing a Medicare plan can feel, well, pretty overwhelming, right? But it really doesn't have to be. Today, we're going to cut right through all that confusion. We're here to help you understand your options so you can make the absolute best choice for your future.
The good news is we're all living longer than ever before, which is fantastic. The challenge, though, figuring out how to pay for all the healthcare that comes with those extra years. For a lot of folks, those potential costs can be a real source of anxiety.
And that's exactly where Medicare is supposed to come in. But let's be honest, with all its different parts, rules, and deadlines, it can feel like you're trying to solve a giant maze. Don't worry though, we're here to give you the map.
So, at its heart, what is Medicare? It's a federal health insurance program that's actually been around since 1965. Its whole mission is to provide hospital and medical coverage for people who are 65 and older, and also for some younger people who have certain disabilities.
Okay, if you only remember one thing from this entire explainer, make it this. Despite all the complexity, the entire Medicare system really just boils down to one big choice, a choice between two main paths. If you can get your head around this one decision, you are well on your way. So what are these two paths? Well, on one side, you've got Original Medicare. I want you to think of this as the a la carte option. You pick and choose your pieces, and it's run directly by the government. On the other side, you have something called Medicare Advantage. This is more like a pre-packaged combo meal that's offered by private insurance companies. Let's break down what's in each one. All right, let's dive into Path 1, Original Medicare. This is the traditional route, and it means you're going to build your coverage piece by piece, starting with two core components, Part A and Part B. First up is Part A. This is your hospital insurance. Basically, it helps cover your stay if you're actually admitted to a hospital or a skilled nursing facility. And here's the good part. For most people, there's no monthly premium for Part A. Why? Because you've already paid for it through taxes while you were working. But, and this is a really big but, premium-free does not mean cost-free. Not even close. If we use 2021 numbers just as an example, look at that hospital stay deductible. If you're admitted, you're looking at a pretty big bill right out of the gate. And if you have a longer stay, you'll start paying a daily coinsurance. The big takeaway here is that even with Part A, you can still face some pretty substantial out-of-pocket costs. Next up in your a la carte meal is Part B, your medical insurance. This covers pretty much everything that happens outside of a hospital stay. Think doctor visits, lab tests, outpatient procedures, and preventative care. And unlike Part A, just about everyone pays a monthly premium for Part B. So you've got your hospital and medical coverage. You're all set, right? Not quite. And this is a part that really surprises a lot of people. Original Medicare leaves some pretty big gaps. You are on the hook for 20% of the cost for most of your Part B services, and there's no annual cap on that. Plus, it doesn't cover most prescription drugs, or things like dental, vision, or hearing aids. So how in the world do you fill those gaps? Well, this is where people add more items to their a la carte plate. They usually buy two extra, separate, private insurance plans. One is called a Medicare Supplement, or Medigap, to help cover that 20% coinsurance. And the other is a Part D plan for prescription drugs. Okay, that was Path 1. Phew. Now let's explore Path 2, Medicare Advantage. Remember, this is the combo meal we talked about, where everything is bundled together for you in one package. Medicare Advantage is also known as Part C. Now, these are plans that are offered by private insurance companies that have a contract with Medicare. The really key rule here is that they must provide, at a minimum, all the same benefits as Original Medicare Parts A and B, but they almost always go further, bundling in things like prescription drug coverage and other extras. So how does it actually work? Well, you still have to enroll in Parts A and B, and you still have to pay your Part B premium to the government. But then you choose a private Medicare Advantage plan. These plans often operate like an HMO or a PPO, which means you'll probably need to use doctors and hospitals that are in their network. So what's the big appeal? These plans often bundle in those extra benefits like dental, vision, and hearing that Original Medicare just leaves out. Now listen up, because this next part is maybe the most important thing we'll talk about. Regardless of which path you think is right for you, there is one thing that is absolutely non-negotiable: getting your timing right. Missing your enrollment window can have serious, and I mean lifelong, consequences. When you first become eligible for Medicare, you get a 7-month window to sign up. It starts 3 months before the month you turn 65, it includes your birth month, and it ends 3 months after your birth month. This is your initial enrollment period, and it is the single most important deadline in this entire process. So what happens if you miss it? Well, it's not pretty.
The consequence is really clear and pretty severe. If you don't have other qualifying health coverage and you delay signing up for Part B, you're going to face a penalty. And this isn't just a one-time fee. It gets added to your premium for the rest of your life. And this number right here shows you just how serious it is. For every single full year that you delay signing up for Part B, your monthly premium will be permanently increased by 10%. So if you wait 2 years, that's a 20% penalty. Wait 5 years, it's a 50% penalty. Forever. The crucial point is do not miss your window. Okay, let's bring it all back together. We've walked through the 2 main paths for getting your Medicare benefits. And really, it's a foundational choice that's going to shape your entire healthcare experience in retirement.
So here it is, the final side-by-side. With Original Medicare, your biggest pro is flexibility, total freedom. If you travel a lot or you want to see a specific specialist anywhere in the country, this path gives you that. The con? Unpredictable costs, unless you buy those separate Medigap and Part D plans. Now with Medicare Advantage, the pro is simplicity and predictability. It's an all-in-one plan, usually with an annual out-of-pocket maximum and some nice extra perks. The con is that you may be restricted to a local network of doctors, which is something to really think about if you, say, spend your winters in another state.
Ultimately, there's no single best answer here. The right choice really depends on what you value most. Do you prioritize that nationwide freedom to see any doctor you want? Or is the simplicity and predictable cost of an all-in-one plan more appealing? Answering that question for yourself is the very first step to choosing the path that's right for you.